Okay, good evening, everybody. Thank you for coming. It's 7 p.m. and I call the September 13th, 2021 school board meeting to order. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Anita, would you please call the roll?
Jennifer Deek. Here. Harry Dunlap.
Here.
Cheryl Hancock is excused. Anita Jagosinski, I am here. Chris Lau.
Here.
Rebecca Reber.
Here.
Brian Wolpat.
Here.
Emily Zach.
Here. Okay, thanks, Anita. With 6 of the 7 board members present, I declare a quorum. I note that the agenda has been posted, distributed, and sent to the local media. With this in mind, are there any changes to the agenda? I would entertain a motion to approve the agenda as published.
So moved.
Anita?
Second.
And Brian has second to approve the agenda as published. Any discussion? Hearing none, all those in favor of the motion to approve the agenda as published, please signify by saying aye.
Aye.
Those opposed, please signify by saying nay. The motion to approve the published agenda has passed. On to public participation. Is there anyone who wishes to address the board relative to any items at this time? We do ask that a 5-minute time limit per person be followed. And I do have the stack, so Anita will be taking time.
Yep.
And we'll start with Simran Burke on the topic of mask mandating.
Can you remind them that I'll hold this up and then I'll hold
And then Anita will hold the sign up at 30 seconds to give you 30 more seconds, and then she'll also hold the sign up when it's time to be done.
All right. Simran Burke, 800 Oakwood Drive, Holmen. So I'm here today hoping that I can provide a student's perspective on this mask mandate. It's been 2 weeks with a mask mandate at school, and it's far from the so-and-so model that you guys have created to prevent transmission. It's a theoretical construct that everybody's going to fit a mask to their face and wear it properly. Students wear it under their nose, under their mouth, and the virus doesn't just disappear during lunch when nobody is socially distanced or wearing masks. This reveals the true colors of this mask mandate. Is the mask mandate designed to keep everyone safe? Of course not. You're happy to place this burden on children. If it's not designed to protect the adults, they can get vaccinated if they want to, and the children are not at risk of this disease. The whole thing is political. When the CDC said that you don't have to wear masks if you're vaccinated, all of you were sitting here with no masks. And now that the CDC switched their decision, all of you are here with masks on. So does this mean that the bureaucrats in Washington, D.C. know what is best for the children rather than their parents? Think about the kids that you're disadvantaging, who don't agree with this mask mandate, but they don't have the money to go to a private school. They can't just be homeschooled. Their parents are busy. COVID poses no risk to children at all, and that's a fact. 4.2 million children have tested positive for COVID-19, and 0.008% have died. Compare that to the flu. From 2018 to 2019, a total of 480 kids died from the flu, which is more than children dying from COVID in a year and a half. Nobody was suggesting on this board that all of our children should wear masks for the flu, which is more dangerous to kids than COVID-19. It's crazy that my youngest sister, she's in preschool, and she has to wear a mask to school every single day. You're forcing them to wear a mask for a virus that poses almost no threat to them. It's amazing how many experts we have here in this room who are experts in education, and you guys think that the psychological damage that you are doing to children is less harmful to them than COVID. You're not allowing young children to form connections between names and faces, and you're teaching them that everyone around them is sick. And of course, there are health effects. They have to breathe through essentially sweat-soaked rags all day, and the damage to their immune systems when they're wearing a mask all day. I've seen the false binary come up at these meetings that there are only 2 choices. You either do virtual school or you just comply with masks in school. But that makes no sense. Just picking the better of 2 options doesn't mean that there is an option that is best for everyone. There was actually a study in Denmark that found that surgical masks did not protect the wearer against infection with the coronavirus in a large randomized trial, which is the only mask study that was actually done in real conditions. 42 people in the masking group got COVID, which was 1.8%, while 53 in the unmasked group, which is 2.1%, got COVID. So the numbers are very close. And when people say that there are a number of other studies, those studies are basically just taking a mask and spraying aerosol at it. The goal was never zero COVID, and now we need to accept that is a part of our life now. So what do? Do we say a goodbye to a return to normalcy forever? Because you haven't provided the metrics for us to provide to come back to school with no masks. Or we need to accept that it's part of our life now. I'm sorry, but if you can sit up there and listen to parents time and time again present you with science, data, and their concerns, and you simply turn a blind eye, frankly, you should all be ashamed of yourselves if you're going to not listen to what the parents have to say and what they want for their children, and simply say that people that don't want to wear masks, they're selfish, and you have to be, if you're wearing a mask, you're respectful, and if you're not, you're disrespectful. Thank you very much.
Adeline Osgood for the topic on masking. Okay. And just to remind you, the children don't have to say their address.
Hi, my name is Adeline Osgood, and I am a 5th grader at Prairie View Elementary. I love seeing my friends and going to school. Last year when we had to do virtual school, I didn't like it at all, but at least it kept us safe. So we need to work together and wear masks so no one has to do virtual school anymore. Also, thank you to the School District of Holmen for mandating masks to keep everyone safe. Wearing a mask, it's not about me. It's about everyone else. And if anyone ever wants COVID to be over, they should wear a mask.
Abigail Johnson on the topic of masks.
Hi, my name is Abigail Johnson. I think we should wear masks because we have to make sure we are keeping everybody safe and we stop COVID. I listen to people who study medicine and diseases. They are experts, and I am glad Holmen is following that rule.
Thank you. Tricia Johnson on the topic of support of the school board.
Good evening. My name is Tricia Johnson, 1501 Pioneer Drive, and I'm the mother of 2 Evergreen kids that absolutely love getting on the bus and spending their day at school. I could go on and on about the wonderful Holmen school staff, but that is why I'm here tonight. I support all efforts to keep kids attending school in person. While online school taught my kids lessons they wouldn't have otherwise developed, I feel being in the classroom is ideal for them. In order to keep kids safely in the classrooms, I agree that we stick with the resources established by the board for administration to use in their decision-making. These resources have been identified and established for some time now, long before the pandemic hit. It is not our place now to change those guidelines from the highest medical professionals making informed decisions in this dynamic environment, and I believe we place trust in their judgment. In what other circumstance would we ever condone the board voting against CDC and healthcare professional guidance? That is nonsensical. The board has no business injecting personal opinion or, frankly, their own research to do so because they are not qualified. This is not their area of expertise, and thus they defer to those who have the reliable education and credentials. We know that this virus has plenty of unknowns, especially with the new variants, which further supports the need to rely on medical professionals. Even they admit there is no perfect answer or prevention method, but their guidelines based on research and evidence is our best guess, is our best defense. The American Heart Association suggests defibrillators at the schools and gymnasiums. The chances of needing them are low. They are not guaranteed to save a life, yet we have them because if we can save a life, it is the right thing to do. We wouldn't think to go against that type of recommendation. I see the mask and the current CDC guidelines as an equivalent example. It isn't perfect, but if it could save a life, isn't it just the right thing to do? I thank the board for their continued diligence in keeping our students and community safe. I know this is a thankless and very difficult job, but please know your efforts and dedication are very much appreciated.
And then Quinn Moldenhauer on the topic of masking in the district.
Hello everyone, my name is Quinn Moldenhauer and I'm a sophomore at Holmen High School. I'm here because I wanted to give you another student's perspective and I wanted to speak about why I support the board's decision to make masks mandatory in our schools. It has been very clear over the last few weeks that COVID cases are rising and keeping masks on everyone in the district, I believe, is crucial to us staying in person. Not only that, but I am here because I want to support those who the vaccine doesn't work for. There are kids in our school district that have weakened immune systems, and even if they get the vaccine, they aren't able to build the antibodies to have an effective immune response. On top of that, there are students who can't be vaccinated and some who also choose not to be vaccinated. Masking all of the students in the district is one of the biggest steps the board is taking to keep us in school. I am here because I want everyone to be able to learn in an environment that supports them. I have a 6-year-old sister at home who wears hearing aids and virtual learning was a struggle for her. When she couldn't hear everything the teacher was saying, she disengaged and fell behind in her classes. In-person school for her and many other kids in the district could be the difference between falling behind and staying on track with their fellow classmates. Requiring masks is a critical stance the board is taking to assure everyone is getting a supportive learning environment. I am here because I want my peers to have the best opportunities they can possibly have. Yes, school is for learning, but it's also for creating opportunities, especially for the high schoolers. Last year, COVID greatly affected the ability of my peers to participate in after-school activities such as athletics and clubs. Building up a college resume is already hard enough when you are in high school. Adding last-minute canceled meetings and little to no in-person activities doesn't help. Keeping masks on everyone keeps us in school and therefore gives everyone the best opportunities they can possibly have. The board is setting an example for other schools who chose to make masks optional and now have 50% of their student body out and now are reconsidering their decision. I am here because I most importantly want to protect all of the members of our community. When we are talking about masking students and staff in the Holmen School District, we are talking about keeping everyone safe. Our goal as a community should be to protect everyone and not just have ourselves in mind when we think of masking. I would like to finish off my time by thanking the board for keeping us safe this year by enforcing masking and social distancing.
Caitlin Savvy, masking and STEM education.
Okay, hi, my name is Caitlin Zowie. I'm at 1118 Newport Lane in Holmen. I kind of wanted to, everybody else had their responses all typed. And I just wanted to express, I wanted to kind of start with a story. So this is my daughter Neela. She wanted to stand up here with me today. When she was born, she had pretty severe seizures. And I was told when she was born that we should delay vaccination just because of the risk of febrile seizures. As a new parent, I did the research that was available to me. I looked on the internet, and wow, there's a lot of stuff on the internet about not vaccinating your kids and how they're bad for them, and it was very scary to me. I was very overwhelmed, and it made me fearful for her safety. And for about 2 years, I operated out of that fear, and I listened to those things that I had seen. There's so many different confusing and misleading things that present themselves as science. And I consider myself a pretty intelligent person. I got through high school. I was working on my bachelor's degree when Neela was born. And then it wasn't until I started my master's program that I really learned what it means to conduct a scientific study, to, go through peer review processes and understand reliability and validity of research, and actually conduct those studies. Now I'm here to say that I was scared of science in that example. It was misleading and confusing, and there was a lot of information. So I understand where people are coming from when they say, when there's so much information about masks maybe being damaging and, like scary information out there. However, as someone who has grown and learned how to read scientific studies and understand things, I have not, in my own research, which everyone suggests that you do, seen any studies that actually support masking being harmful, or that masking doesn't, benefit all of us. It does help reduce the spread of COVID from everything that I personally have read. And when people say do your own research, I think a lot of people are listening to things that are put out there that aren't necessarily science, and they're manipulated in the ways that I did when Nila was younger. So I was very misled at that time. So again, I also know that there isn't a lot of access available to the public to actually access those studies. And it is kind of scary sometimes for people to listen to, as we heard before, medical staff and actual experts. But now that I see how my views previously were misled, and I've grown from that, I just want to say that I'm super grateful that no sweeping policy changes were made out of my ignorance. I'm grateful that I wasn't in a situation where I had to advocate so strongly out of a place of fear. And I just wanted to thank the Holmen School Board for supporting the mask mandate, because we have that information, and we're not, focusing on, pseudoscience or, uninformed scientific studies that aren't science. So I also additionally want to say that I think that this experience for all of us, and hearing what students and adults in the district have to say, highlights our need for more comprehensive STEM education. If we have people in our district who are really struggling to actually understand science, I think that it is important that we focus more on teaching people how to critically evaluate scientific studies so we don't have issues like this in the future, and also focus on history and seeing where we came from. So thank you guys so much for everything that you do.
Thank you, Caitlin. Sarah Osarek, I apologize if it's pronounced wrong, sorry. Say it again.
Susic.
Okay. Support the school board and mask mandate.
Hi, my name is Sarah Susic, and I'm in 8th grade at HMS. Over the last few weeks, I've heard my mom talking about some of the parents that don't want their kids to wear masks at school. But really, I think the parents are more upset than the kids. Most kids at school don't really care about wearing masks. Yeah, none of us want to wear it, and it's uncomfortable sometimes. But we are still wearing it, not because we have to, but because it's the right thing to do. Even though everyone in my household, including me, has been vaccinated, we are still wearing masks in most places. We know that we won't get as sick from COVID, but even if we won't get as sick from it, we could still give it to others who aren't vaccinated. And that includes my niece and nephew who aren't old enough to get vaccinated, and my unvaccinated classmates. I can't speak for all students, but I, for one, am fine with wearing masks as long as it is needed. If everyone got vaccinated or just wore a mask, maybe we could get rid of COVID for good and everything can go back to normal. Thank you for listening.
And then Tony Lukey on personal choice.
Tony Lucky, Holmen, you have my address. I'm not going to announce it over YouTube again. I would like to share my observations in our community. with the school board, as the school board should represent the values of our community at large. When we go to any store or public place, we see very few people wearing masks. As the public has the choice and the option to wear masks, and the overwhelming majority choose not to, the community is speaking. This board or any elected official must put their personal beliefs and opinions aside and represent their community. We ask for choice over our bodies and the bodies of our children. A simple survey of parents and or the community as a whole with published, authentic results posted for everyone to see would be an easy way for this board to put this contentious decision in the people's hands, much as they did with the in-person schooling. I asked to give us a choice and to allow these children to show their smiles. Thank you.
Thank you. Trustee Tweed, on the topic of support the board and mask mandate. Christy Tweed? Sorry.
That's okay, I just didn't hear. I'm sorry.
Oh, you're good.
My sticker. Christy Tweed, N6746 McCurdy Road. I'm a district parent and I support the temporary mask mandate. I know there are a lot of people in the community that feel the same way I do. No one wants a mask mandate. We just understand when there's a need for one. And I'm going to go a little off script here and say that doesn't always stay the same. The mask mandate is not always going to be the same. It's going to be according to what the guidelines are and what the variants are doing in the community. So that's why you would maybe not have a mask mandate one week and you would the next week. I've been watching the school board meetings online. There have been some very vocal participants from both sides, and I felt that each side, or the side that supports the board, has been a little underrepresented. That's why I'm here today. I was also very upset by the actions of some community members online after the meeting. I saw very mean, even threatening posts, not just towards the board as a whole, but directed individually at board members. I just got to the point where I felt like I needed to do something. So I started an online group, a Facebook group called Holmen Citizens That Support Our School Board and Temporary Mask Mandate. In 2 short weeks, we have over 500 members. A week ago, the group decided to do a statement of support and send it around for signatures. The statement reads, I support the Holmen School Board in its decision to follow district policy of implementing local, state, and federal guidelines on masking. I encourage the enforcement of such policies to keep our children learning in person. As of tonight, we have 628 signatures. The breakdown is as follows. 290 parents in the district, 85 concerned Holmen residents, 113 students, 62 staff members, and 82 that fall into other category. This is just after a week. After reviewing the data, because some people fell into more than one group, I found that we had over 390 adult residents, potential voters, that signed our statement of support. That was again after 1 week. Some of the people that fell into the other category are non-citizens of Holmen. Concerned people like concerned grandparents of students in the district, older siblings of students, people close to families in the district that have immune deficiencies, healthcare workers that work in the community but don't live here, HHS alumni, and more. I believe we are the majority. The reason I believe this is because we voted in a free and fair election to put the board members where they are. We elected them to follow district policy, which they have done. We elected them to make the best decisions regarding the safety and well-being of our kids, which they have done. We elect them to follow the law, which they have done. Thank you all for that. I've heard a lot of complaints about mask policy violating people's rights and liberties and freedoms. The thing is that sometimes the best interest of the community outweighs personal freedoms. It's been decided by the Supreme Court and upheld for over a century. In the Supreme Court case, Jacobson v. Massachusetts, in 1905, Jacobson sued the state for fining him for not getting a mandated smallpox vaccine. He lost. The Supreme Court ruled that the state had the right to enforce the mask mandate. In the opinion, The court determined that individual liberty is not absolute and subject to the state's police power. Police power basically means that constitutional rights are subject to the government's authority to protect the health, safety, and welfare of the community. We don't always like laws or, in this case, school policies, but we should be encouraging our kids to follow them. I don't always agree with everything. I didn't necessarily agree with the dress code. I think it's a little biased against girls. They can't wear tank tops where the bra straps hang out. I mean, come on, it's a bra strap. One of my daughters said, "I'm sorry, I have shoulders." But would I tell my daughters to ignore the policy and go to school with their dress however they want? I don't. Of course I wouldn't. Even if I disagree with the policy, for me to advise them to go against that policy would just be poor parenting. I must also say, I don't think some people understand the devastation of this virus. My dear friend, Chris Huff, who couldn't be here tonight, wanted to share with you that she was not anti-mask, but she felt it was a choice, that everyone had their right or freedom to not wear a mask until she lost her dad to COVID. He was the 8th person in the county to pass from COVID, and she will now beg you to wear a mask and follow recommendations. She will tell you to not wait until someone dies, someone you love dies. Finally, I implore my fellow district parents to really talk to your kids, find out what they think. Are they fighting this battle because they hate wearing masks, or is it because of your own personal beliefs? I've asked my kids and many of their friends, I know you don't like wearing masks, no one does, but if it means you might, just even might, save one person from getting really sick or dying, will you? Every single one of them says yes. This shouldn't be political, it's just about common decency and kindness. Be safe, be kind, and if everyone follows the policy and uses good judgment outside of school, maybe we can get back to normal.
Thank you, Christy. Outside.
No, that you can go ahead and just call her name.
Lindsay Newman wants to speak on policies. Lindsay? Okay.
Sorry, I'm still listening to Christy.
No, you're good.
Hi, Lindsay Newman, N6843 McCurdy Road. I'd like to address a little different side to the sickness, as I'm going to call it, fear. Definition of fear is an unpleasant emotion caused by the belief that someone or something is dangerous, likely to cause pain or a threat. Some of the universal triggers for fear is a threat of harm, real or imagined. This threat can be for our physical, emotional, or physiological well-being. While there are certain things that trigger fear in most of us, we can learn to become afraid of nearly anything. Early exposure to extremely fearful events affect the developing brain, particularly in those areas involved in emotions and learning. For young children who perceive the world as a threatening place, a wide range of conditions can trigger anxious behaviors that then impair their ability to learn and to interact socially with others. Science tells us that unlearning fear is fundamentally different process from fear learning. The process of unlearning conditioned fear is called extinction and actually involves physically separate and distinct areas of the brain's architectural from those into which fear responses are first incorporated. Research then tells us that fears are not just passively forgotten over time, but they must be actively unlearned. Studies show that fear learning can occur relatively early in life, whereas fear unlearning is only achieved later when certain structures in the brain have matured. Consequently, early fear learning can have a significant impact on the physical and mental health of a young child that can take years to remedy. This information was found in the Center of Developing Child at the Harvard University National Scientific Council on the Developing Child. Facts from the news from the Center for Disease Control and Prevention from December of 2020. The proportion of visits to the emergency department for mental health concerns rose by about 1/4 among children ages 5 to 11 years and by nearly 1/3 among 12 to 17-year-olds in 2020 compared to 2019. The team analyzed hospital data on children under 18 years from the CDC's National Syndromatic, I'm not sure how to pronounce that word, surveillance program. Adolescents aged 12 to 17 made up the largest proportion of emergency department visits for mental health. The proportion of their emergency department visits for mental health was 31% higher in 2020 compared to 2019. For children ages 5 to 11 years, the proportion of mental health visits was up 24%. Science shows that exposure to circumstances that produce persistent fear and chronic anxiety can have lifelong consequences by disrupting the developing architecture of the brain. So, what are you doing to help children not be fearful? Or are you, as a school board and school district, contributing to this fear by imposing policies and restrictions on students that promote fear? In our household, fear is not an option. We know fear is a liar. But not all children know these truths. How are we as a school board and community supporting these children? Factors that attribute to fear in schools: logical thinking. Logical thinking is the act of analyzing a situation and coming up with a sensible solution. Similar to critical thinking, logical thinking requires the use of reasoning skills to study a problem objectively, which will allow you to make a rational conclusion about how to proceed. In advisory class at Holmen High School, you can have your mask off for the first 10 minutes while you eat, but then you have to have it up over your nose the rest of the time. Speaking of logical thinking, you can eat lunch with your mask off for the duration of the lunch period, while you sit close to your peers, but not in the classroom. You can sit outside on the bleachers packed like sardines, but inside the classroom, you cannot do that. You have to have the mask on. We can walk into a grocery store, Walmart, church, and talk and stand next to hundreds of people from all over town, but not in the classrooms. Vaccinated versus unvaccinated children are treated differently, but yet an unvaccinated child has different rights than a vaccinated child but yet they both are a threat and contract and get sick. Again, logical thinking. Some of these things do not make any logical sense. My question and concerns are for our children to not be in fear. Fear that if they get too close to someone with or without a mask, they can get them sick, and then that person might get their family sick. Or fear that if they themselves get sick, will they die? These are illogical fears for children. They should not fear death, nor should they fear giving someone else a death sentence. That is a heavy burden for anyone, let alone a child, to bear. Then there is the illogical rules and policies that these are the illogical rules and policies that children face.
Time's up.
Thank you.
Thank you. Tobias Newman on policies. Tobias?
Hello, my name is Toby Newman. I wanted to talk about my own personal battle with wearing a mask. My parents have been they've been going back and forth with the administration about getting a religious and medical exemption. But so far, the only option I've had is to wear a face shield and plexiglass at my desk and social distancing in the classroom. I don't think any student would want to do that, and I've seen no other student use this method in the classroom. And none of those options are solving my problem and and make me feel like I belong, which is one of Holmen's visions for the school, and the mission is preparing students for tomorrow through engaging and exclusive educational communities today. Wearing a face shield in another room is not inclusive, nor do I feel like I belong to the community when I'm not accommodated for. Thank you.
Thank you. Titus Newman on policies.
Titus Newman, and 6843 McCurdy Road. In almost every topic available, there are at least two separate sides or viewpoints of that topic. That is because everyone has different beliefs in some way. And like that, you can see two clear sides in this room, one being for wearing masks and the other being against. I'm just going to go ahead and say I'm against wearing masks, but that doesn't mean that I don't respect the other side. I know that everyone has their own beliefs and their own reasons to support those beliefs. However, when they begin to impose their own beliefs on others is where the line should be drawn. It is the same reason why we don't allow teachers to talk about religious or political topics in class, because it would be them imposing their own views and beliefs on the students. This is the same thing that you've done with the mask mandates in school. You forced one belief on all of the teachers and students regardless of their own beliefs. For those of us who are against wearing masks for our own reasons, that is a direct assault against our beliefs. That is why I believe that the best course of action would be to make masks optional. For those who are for wearing masks, they can wear masks and have their children wear them. For those who are against them, will choose not to wear masks. I completely understand your situation. There are two sides telling you completely different things, and either way you'll disappoint one of them. However, this way, with masks optional, everyone will have the ability to do what they believe, to wear or not to wear masks. Earlier this meeting and every school morning, the entire school says the Pledge of Allegiance. One part says liberty and justice for all. Liberty is freedom from arbitrary control, and liberty is the power of choice. That's something that you're directly against right now. That's it.
Thank you. Thank you. And Joshua Newman?
Good evening, Josh Newman, N6843 McCurdy Road. I'm here once again. I've been here before because I believe our kids are worth it. I believe it's worth our time. I want to speak to you guys as the board and as others making the decisions on this policy in regards to masks. And I hope also that I'm able to speak to our community tonight and that these words hit hearts and minds that are soft and open and willing to hear. I think that's part of our issue in navigating this, although I've been very pleased with the level-headedness of all the speakers tonight. Is that we're not willing to consider other people's perspectives. When we consider other people's perspectives, it brings calm to us. To make good decisions, we have to have calm. A lot of times people make emotional-based decisions, and you're never making a decision from a place that's rooted in true wisdom when you're based off of an emotional response. Over the last 2 weeks, had the opportunity to sit down separately with 3 of our board members. Was able to meet with Brian and Anita and also with Cheryl, and it was really a great time, constructive time. We chatted for over an hour and a half, actually, with each of them, and appreciative of their time. Here's what I found out. Listening to their perspectives, I sincerely believe that at least those 3 and all of you are making decisions based on what you believe to be in the best interest of our students. And so I want to just encourage you to keep your decision-making, keep emotional responses out of your decision-making. Sometimes when we hear responses at the end of the meetings, they're made from an emotional place, and it does not set us up for success as a community. So I want you to keep that in mind. Tonight I want to introduce a different perspective on some information that we're using when we make decisions. There's one issue I want you to consider that I believe has not been given proper weight thus far as we've been making these decisions for our school and our community. There's 2 aspects to this. The first, the issue is mental health of our students. The first issue is fear and anxiety. 1 in 4 youths is now experiencing clinical levels of depression symptoms. 1 in 5 is experiencing clinical levels of anxiety issues. What proportion of our students, 25%, experiencing depression issues, does it need to reach before we start really paying attention to that? This comes from a lot of different areas. A lot of it is out of our control. Newsweek, August 13th, published an article called The Doomsday Variant. And as you open the article, it quickly told you there's no such thing as the Doomsday Variant, but there could be. How worried should we be? Fear, like my wife so eloquently said, is a liar. False evidence appearing real. And we often allow our imaginations to determine or imagine what the worst thing could be in a situation and make decisions off that. According to the CDC, the annual death rates among children ages 5 to 14 years old, children have a higher rate of death in cancer, vehicle accidents, suicide, that's sad, homicide, heart disease, drowning, and the flu, all greater than COVID-19. New study of 5 million COVID-19 patients just came out a month ago. The new predictor of mortality once someone has entered a hospital has been a new predictor, has risen to virtually tie number one. It's always been obesity, that's a comorbidity that will be the number one factor of their mortality. Guess what's risen to number 1 and 2, tied with number 1? Fear and anxiety related disorders. These disorders weren't even on the list a year ago. The second issue that deals with our kids' mental health is what happens when we make students act in a way that goes against their beliefs. When they do something they don't believe to be true. When we force them to acquiesce to authority, even though they don't believe in what they're doing and what they're being told to do. See, students get confused by the standards that we give them. They see hypocrisy all over the place. They see leaders telling them that it's essential to wear a mask in order to be safe, and yet they see these same leaders throwing birthday parties in closed, confined rooms, and no one has a mask on. They are told to wear masks in their classrooms, and they see 75,000 people in football stadiums across the country not wearing masks. This is like, and we see this everywhere else. My wife mentioned it in advisory and in class, in the lunchroom. It's all over the place. It's like when I teach my kids to act in a certain way and they watch their dad act in another way. It's not how we teach people. If they don't believe in what the way they're being required to act, we make them live in conflict with their convictions based on what they're seeing with their own two eyes. It's not healthy. Please keep in mind the 25% of students that are dealing with depression, 1 in 5 dealing with anxiety, and make your decisions not based on fear, but on what we know to be true. The death rates of kids 5 to 14.
Time's up. And I believe we have Eric Jensen on the mask mandate.
Eric Jensen, W7881 Prairie Lane. Good evening. I'm here to speak in support of district leadership and the decision to mandate masking. I don't know what I can say to those who oppose the mask mandate to convince them that this is the right decision. We've heard that nearly 700,000 have died in the past 20 months from COVID, and either they don't believe that, think it's overstated, or value other things more. With those who don't believe or think it's overstated, they can read the La Crosse Tribune from roughly 4 weeks ago that said that Gunderson's reopening the COVID unit. 2 to 3 weeks ago, Gunderson had 20 to 30 COVID patients on their nursing floor. Within the last week, it's up to 40 to 50. That's a huge increase in a short period of time. And that is a large portion of Gunderson's nursing capacity. If they don't believe the 700,000 and they don't believe the 40 to 50 at Gunderson, I don't know what else to say, but what would you believe? Others value other things than reducing case counts, like personal freedom. I'm a huge personal liberty guy myself. My basic understanding of freedom is that I can do whatever I want so long as it doesn't put other people in harm's way. We have government to put policies and guidelines into place so that this harm can be prevented or at least enforced. We also have government to take collective action as a society. We have public schools, libraries, roads, law enforcement, fire protection, military. Deal with emergencies like the flooding you see down south. Flooding when it happens here is tornadoes when they happen here, and pandemics. My son is he's in 6th grade now. He's required to have the DTaP vaccine. Is this an acceptable reduction of freedom? I think it is, because we've nearly eradicated diphtheria. Tetanus was less than 100 cases in the United States last year. And whooping cough is down from hundreds of thousands of cases decades ago to between 15 and 20,000. Two quick personal reasons why I'm passionate about this. My mom has MS and has been on immunosuppressing drugs for 30 years. Her body cannot fight off a sinus infection. She's had her vaccine booster. Even with that, she's still susceptible. My nephew has a rare genetic disorder, and every year we go to a Cure SMA. It's a fundraiser. It's called a walk and roll. Roll because all the kids are in wheelchairs or power chairs, medical devices, things like that. Not a year has gone by where a kid who was there the year before, we had to have a moment of silence for the year after. It's almost always due to respiratory issues. I worry about what would happen if my nephew got a breakthrough infection. How many similar stories are there in this district? So my mom and my sister's family have to take steps that most of us don't. They can't go out. They're not worried about a mask mandate because they really can't leave the house. Are they free? I don't think so. So I ask for some compassion for folks like that. For everyone to be free, we need to get cases down and reduce infectiousness. This is not just a school issue, but a community issue. The Delta variant is highly infectious. We want kids in school learning where it's best. In order to do that, we need to follow the guidance from the experts, not public opinion. We need to distance, mask, and vaccinate. Thank you.
Nora Swanson on the mask mandate. Nora Swanson.
Hi, I'd like to start off by thanking the school board for letting me speak here today. I will be addressing my thoughts and concerns about mask wearing and social distancing in schools. Coming from someone with a household of 4 asthmatics, and from someone that's considered high risk because of their asthma and because of their daily medications, it is very important to me that Holmen keeps their mask mandate and works on social distancing. First, I will talk about the most important one right now, masking. CDC states, even if fully vaccinated, you should still wear mask to maximize protection from the Delta variant and to protect others. If you have we all know masks aren't the most comfortable, but when it comes to saving your own or others' lives, it's 100% worth it. Next, I'll be talking about social distancing. CDC says in several articles, masks are not a substitute for social distancing. In school, CDC recommends 3 feet. Even if that's not possible, it makes even more sense we have this mask mandate. So coming from a 6th grader at Holmen Middle School who's been hospitalized with breathing issues before, I don't want to see anyone else go through that. So please mask up and stay safe. Thank you.
Thank you, Nora. And then Tony Zach on the topic of masks optional. Tony Zach?
Tony Zach, 808 Winchester. Some of us have been attending these meetings for a while, and it's great to see how many have decided to show up and support their views. This all started by asking the school board to make masks optional. The board did hear us for a while, but 2 days before school started, they decided to make masks mandatory for everyone. So I asked the question to the board, who do you represent? The teachers, the taxpayers, the parents? How about the students? Then I asked another question, do you even remember being a kid? Do you remember how difficult it was growing up, making friends, finding your way? The masks we put on these kids of all ages just make that much more difficult. There's a group here tonight called the Holmen Parents that support the school board or something like that, and I was, of course, not allowed to be in this group because for some reason I must not support the school board. Well, in fact, I do support the school board, and I've been here time and time again thanking you for being in this position. However, because I disagree with some of your policies, somehow I'm not worthy to be a part of this group. That's fine with me, but I would like to know why this group and this board continue to divide us. Is there not any middle ground anymore? This group will provide signatures of around 350 parents that want to keep masks on our kids. That, what is that, 0.035% of the village of Holmen? Does this 0.035% represent all the parents? The answer is no. Since I'm on the numbers, do you realize that less than 20% of Holmen residents voted in the spring election? What you need to realize is that I have come before this board many times, letting you know that I represent more than just myself. I represent those who are fearful to show up. They are fearful of the mob going after their livelihood and their family. The cloth masks that our kids wear do them no good. You cannot cite one study showing that cloth masks are effective on kids because the study still does not exist. I think it is absurd that we would sit here today and say, well, the kids have been wearing masks, so that is why the numbers are so low. How about this? This pandemic is over. It is time to unmask our kids. We have just been asking to make them optional. You're scared. I get it. We all were at the beginning, but the data does not justify nearly 2 years of cowering in fear. It certainly does not justify mandates, especially for our children. Stop with the fear. Here's a quote from the last meeting from one of our school board members. Quote, "If it were up to me, I would make mandatory vaccines in the high school." Unquote. This is where we are going. Just wait for it. It will be pushed. Another quote from one of our board members, quote, if you only believe in democracy when it works in your favor, but not when it works in a different position, then you don't really believe in democracy," unquote. The fact is that America is a democratic republic. That means that we have individual representation. That means that mob rule is not the way things work. However, because we have no voice on this board, we are experiencing mob rule at a local level. Not one person on this board represents me. My challenge is this, not to this board because my words will again fall on deaf ears, but to those who hear me now, it is time to get involved. And now we get to the cold hard truth. Not one of the voting members on this board represents my views, not one. That is the fault of the people not getting out and voting and paying attention for what is going on. This board is supposed to be nonpartisan, but we all know where they stand. It is time for the patriots of this country to get their butts they got to get off their butts and start getting your voices heard. It is time to get active, and it's time to stand up. In closing, I have to say that I've sat on many boards. In all my years, I have never witnessed the blatant disrespect that was shown to the student representative 2 weeks ago. And frankly, the apology at the end of the meeting was not genuine. It was more condescending than anything. If you're going to allow comment at the end of your meeting, it is not time for board discussion between members. It was a blatant disregard for Robert's Rules of Order, and with all of the experience on this board, I would have expected at least one of you to stand up and say, "Point of order." If you are going to lead as our representatives, then start leading already. It is going to be hard to find another student rep to replace Emily here after the stunt that was pulled by our school board president last meeting. Then I will say this. We don't have a Facebook group because if we had a Facebook group, it would say something like supporting keeping masks optional or Holmen parents want to keep masks optional. It would be removed from Facebook. That's why we don't have a group, because we are censored. So fellow patriots, I say this to you. Step up, stand up, and make your voice heard. Thank you.
Jennifer Wesley? Jennifer Wesley? Jennifer Wesley on masking.
Jennifer Wesley, and my address is on the card in front of you. With every day that passes, my anxiety continues to grow. Every time I turn on the news or read the latest from the district, I become more and more speechless of what's happening in our schools and in our country. It feels like a freight train that is derailing and never ending. These are my kids, they're not yours. I don't need the school's help deciding what's best for them. I need the school to teach them academics and stop treating them as if they're an infectious disease. The damage you are instilling in our children by assuming they are a carrier of the virus, regardless of their actual healthy status, that is damage that will be with them for a long time. You will lose our kids' trust. You keep claiming to be following the guidance and following the science, but you don't seem to be questioning the guidance or questioning the science. Again, Holmen is following, not leading. The anti-maskers and the anti-vaxxers are not anarchists, sorry, but rather they have a firm belief, conviction, or a reason for their decisions not to mask and not to take the jab at this time. It is not stubborn rebellion, and it is not some intentional desire to infect others. It is a very, very personal matter for most of us. For those here tonight rallying to keep our kids in masks, and for those admins requiring the masking of the students, you are simply putting your personal convictions above those of others. It's heartbreaking to cover my child's face every day in order to send them to the public school that they are entitled to. The effectiveness of these masks is the same as the effectiveness of putting up a chain link fence to keep mosquitoes out. If my kid has to wear a mask to protect your kid, it's like asking my kid to wear a raincoat to keep your kid dry. You are elected board members, and you have elected to defer this whole COVID protocol policy to the administration team. That's not fair to the public that voted for you. You have deferred your job to somebody else that was not voted in. It's an awfully cowardly move, if you ask me. And when people speak of masks could save one person's life, let's just mask up because it could save a life. What are we doing to save the lives of the suicidal people that are dealing with fear? Are we doing as much for them as we are for this potentially saving one life by wearing a piece of paper over our mouth? Emily, you probably didn't expect to experience what you're experiencing this year on the board. I just want to let you know that you were elected by the students because you are a great, great person. And I am really, really proud of what you are dealing with and how you have to put up with things right now. I applaud your ability to stand up and speak against something, even if it's not the popular opinion. It means a lot to the public, and it probably means a lot to your fellow students. You're a very bright young woman, and you'll make a great leader someday, so don't be afraid of this.
Barb Wench. Thanks, Jennifer. Barb Wench.
Barb Lynch, N6905 Pine Lane. Good evening. I did not think I was going to have to be back here again. But when my moral and ethical beliefs are being questioned by members of the community week after week, I feel it was my moral duty to speak to you tonight. Because I am tired. I'm tired of having to continually stand up for what I know is right and for what the majority of this community knows is right. I've watched community members stand here and accuse you of not listening when you don't respond to their requests. Or when you do respond, you're accused of bullying. The same people who came here in February making threats over their children's right to be back in school, now they're back. And this is what they're threatening you about. Quite honestly, I'm embarrassed because the Holmen community is better than this. I have a sign on my wall in my office, and the sign reads, "You are free to choose, but you are not free from the consequence of your choice." Consequences. I don't even have to stand here and read the statistics. You already know. You already know that our area COVID units are full. You already know about the area schools who are facing shutting down in-person learning due to high infection rates. All you are asking is for students to wear a mask. You, as the board and the administration, know what the consequences are. You are not willing to put our students and our community members at risk. You know the consequences. So I ask of you, please don't let the voices of the minority deter you from continuing to do the job you were elected to do. Please continue to enact policies that are based on research and best practices so that our children district staff, and community are safe. I leave you tonight with a quote from Mitch Albom's Tuesdays with Maury. So many people walk around with a meaningless life. They seem half asleep, even when they're doing things that they think are important. This is because they're chasing the wrong things. The way you get your meaning in life is to devote yourself to loving others. Devote yourself to your community around you. You have done this, and we support you. Thank you.
Jamie Poe. Jamie Poe, P-A-U-G-H, PA. Masking and COVID-19.
All right. Jamie Paw, N5866 Walden Court, Onalaska. Still in the District of Holmen, by the way, just in case people were wondering. All right, so let's get right to it. First and foremost, I want to thank the school board and Dr. Mueller for making the mask mandate for all students. I think it's an important move and a correct move in our community to keep children, regardless of age, safe while they are in a high transmission of COVID-19, which we are. With our community hospitals nearly at a breaking point at this time, we need to take any steps possible to stop and reduce the spread. The bare minimum is a mask. Okay, that's a bare minimum. Nobody said, let's go get the jab. Okay? It's a bare minimum. Right now, a case in point, because right now, many of our hospitals in this area have been on diversion, not for a day or two. I'm talking weeks. What diversion means is if you go home and you have a car accident tonight, or you go and have a heart attack, God forbid, we may not have room for you. So that means we're going to search for other hospitals that might have room for you. Do you know where those hospitals might be? Rochester, Madison. Maybe we'll send you out to Vernon Memorial because maybe they could take care of you out there, because we sure as heck can't because our ICU is full. So good luck. And case in point, there's an Alabama man that died of a treatable heart disease. He had to drive 200 miles from his home after they called 43 hospitals because there were no ICU rooms. 43. I don't have to convince you, and there ain't nothing I'm going to say to convince the opposing side here, but COVID is a fluid situation, which means it's ever-changing. It means that we can have higher numbers and lower numbers. Oddly, in June, we had lower numbers. Can anyone guess why? The kids weren't in school. So now we have this. And now we talk about masks emotionally harming, medically, and intentionally killing our children by having CO2 retention. Now, I've heard many people talk about how you can't get the COVID virus, the masks don't work. They go right through the mask. Well, wouldn't it be logical that CO2 could also go outside of the mask? How did any of us healthcare people survive? We've been in a mask for 18 months straight for 10 hours a day. And if you don't want to look at that, when you go into a COVID room, I get my lice fluid resistant gown, a pabber hood that looks like I'm part of the Klan, and I get gloves taped to my gown. It's not comfortable. I'm sorry that you're uncomfortable right now with your masks. People with tubes down their throat right now are very uncomfortable on their ventilators as well. So let's get back to it. We talked about the article stating that COVID, the masks were high CO2 retention, because I have a couple notes here. The article in question that you're speaking of is by the Journal of American Medicine, and that article was out on June the 30th. By the way, it was also retracted on July the 17th because it was false. If you come up here starting facts, let's state some facts and have some cited references, people, because I got them all right here in front of me. This ain't exactly my whole speech. As for mass studies, I would like to promote here, and I would encourage anybody, I can give you my copy tonight, the impact of mass distribution, promotion, and mask uptake in the COVID-19 in Bangladesh, which, by the way, is the 8th most populous country at, I believe, 165 million people. Actually says masks work. So they do work. So let's not go on with that anymore. So the only way to get rid of COVID-19, and frankly, it's been kind of a popular phrase, is to mask it, vax it, or you get the casket. Because that's what it's doing to people. It's killing people. And I realize at 16 and 17, you think us adults were never 16 and 17. We don't know anything. I didn't think my mom knew anything. I didn't realize she did realize anything until I was about 25. So, I can't even reach this point. It's just so maddening at this point that we have to go this way. So, and my last point here, survival rates. We always, oh my gosh, it's 98% survival rate. The 98%, that's great to have a survival rate. I would like to point out that survival rate does not, in fact, guarantee that you will go back to the quality of life that you once had. That could mean lifelong oxygen. That could mean you're on a vent for the rest of your life. It can mean a lot of things. Blood clots, lifelong double lung transplants. What more do you need? Christopher Reeve survived a horse from a fall, and he's still on a ventilator and was quadriplegic for the rest of his life. Do you think it was a quality life? No. And finally, I'm proud of the students that protested. Go ahead and do that. It's your First Amendment right. But remember, your rights do not...
Time's up, Jamie. Thank
Yep.
you. Chad Updike, our last one. Chad Updike wants to talk about masks.
Chad Updike, W5531 Olson Road. Majority of what I was going to say has already been said by multiple people tonight. I think the overwhelming thing that anyone in this room can sense is, and multiple people have said it on both sides, is exhaustion, right? And I'm sure all you guys have felt this as well. I'm sure Dr. Mueller especially. One of the only thing that hasn't been brought up that I wanted to bring up tonight is going into this, we knew that there was going to be debate on whether we were going to have to wear masks or not wear masks, right? And when the decision came about that we were going to put masks on kids, I emailed and looked for metrics that were going to be used to determine when we were going to take the mask off of kids. Because when we make that change, I would assume that we won't want to wear them forever. And then I came to the board meeting 2 weeks ago and asked that same question, what are the metrics that we're using? Dr. Mueller did email me back today saying that there will be something coming out soon. But I guess my question is, how can we go into this and not have those things figured out ahead of time? If we think it's bad enough that we need to put masks on, and we're not making decisions just based on fear and public perception, how can there not be an objective point to say this is when we take the masks off? So that's really all I was hoping to bring up tonight. I look forward to that email, and hopefully there's some detail in that. Thank you.
Thank you. That's the end of our public participation, and we'll move on to recognition and thank you.
Yeah, so tonight there's actually about quite a few recognitions and thank yous. We have actually a lot going on at school these days, so I want to take some time to thank our DECA sponsorship donations. Ultra Federal Credit Union and Surgeon Laboratories each donated $500 to help out our DECA chapter, so we thank both those organizations. And then Ultra Federal Credit Union also donated $6,500 to assist with our annual school store hosted by our entrepreneurship class, so thank you for that. This is exciting news. The School District of Holmen received a Focus on Energy rebate of $37,355.67 for recent improvements made to the high school that included adding LED lighting and improving the efficiency of the HVAC system. Just want to thank those involved, and in particular John Daly, because he was very integral in getting that wonderful rebate for improvements in the school. Also like to thank the Lacrosse Community Fund for their donation of $1,330 for their Jim's Grocery Bag Schroeder Fund. The funds will help support the food pantry at the Holmen Middle School, so we thank them for that. And then also, the School District of Holmen wants to thank United Healthcare and Dennis Dresick for the donation of $500 to our Project Live in Adaptive Sports League. It'll be used towards the cost associated with the program, so that was very generous of them to support that program. So we're very thankful. And then just wanted to mention quickly that in thanking you as a board, and we kicked off our celebration at the beginning of the year, you have all been given our pennant here that you can hang proudly wherever you want, representing our school district, and got you a little lanyard for you and some in the shirt. So please enjoy those. So, and that would be it. Thank you.
Thank you.
Thank you, Chris. And then on to reports and discussion, certified occupational therapy assistant agreement. Jill?
Hi. So we entered into a 660301 agreement with CISA for our certified occupational therapy assistant. We had the opportunity to increase this position to 4 days a week, and CISA called us, unbeknownst to them, that they were looking for someone as well for 1 to 2 days a week. And so we were able to do a partnership, like if you remember, we have a partnership with Onalaska for our physical therapists. So we really did a similar agreement, which benefited both of us. We were able to get a high-quality candidate. And so this is just being brought to the board to let you know that we are entering into an agreement with CISA to have this support for our students with special education needs. And it's for the school year, and it will come back again each year that we need it. Any questions?
And it's on consent agenda tonight.
Yep, that's on the consent agenda. Does anybody have questions? No. And then I think, Chris, you said you had a retirement?
Oh, yeah. As we're moving on, I just wanted to make sure I took the opportunity. I received a retirement notification for someone who has been in our district for 46 years of service. Definitely we will celebrate this person greatly at our retirement celebration later in the year. But this person is John Daly, and he is our Director of Buildings and Grounds. He has a long history. He knows our buildings in and out. He's been through multiple referendums and multiple projects and so on. It's been such a pleasure working the years I've been here with him. Those that know John know he has a big heart, and he only wants what's best for our community and our schools, our staff and students. So we thank John for all of his dedication and hard work and endless hours of time, I will say, over these 46 years of service. So he will be with us through the end of this year, so through December, so forth. So that, just wanted to share that this evening before you get to your consent agenda. Thank you.
Thanks. We're on to consent agenda items. Is there anything that needed to be removed, pulled out, to be voted on separately at this time? Okay. Do we have a motion to approve the consent agenda items?
So moved.
Anita moved. Do we have a second?
Second.
Anita and Jennifer second the motion to approve the consent agenda items. Now I'm stuck here. Now we're on to board members' reports and discussions. First, I will call upon board members in the order of the roll call, and I would ask you to present any comments or committee reports you have. And Jennifer, you're up first.
Yeah, so I'd like to thank all those that came to speak to the board today. I actually really enjoyed the different varying opinions and being able to listen to all sides. I also want to thank everybody, all the families, all the students, the teachers, staff, for their support in helping to make the first 2 weeks of school a success. And it looks like all the fall activities have been running smoothly in our district as well. I guess it wasn't mentioned tonight, but we did start up the testing program.
Oh, yes.
At the
yes.
high school, correct?
Yep, Monday. Yes, we do have testing available for our families and students and staff and those involved within our district in any relation, shape, or form behind the high school from 7 7 to 11 a.m. in the mornings, yes.
Yeah, so, yeah, I'm excited for that. I think that's going to be an excellent addition to our district. And I guess just hearing the recent news, congratulations to John Daly. So, that's all I have.
All right, thank you. And then Gary?
Yeah, I'd like to mention that at the risk of cursing the volleyball team, they got a 12-0 start, and if you get a chance to go watch them, go watch them. They're really fun to watch, and they really know what they're doing. But I hope I didn't give them any ill will. I'd like to thank everyone that's talked tonight, especially the kids. That was very brave of them to come in and talk to the school board. And I'd let everyone to know that I do hear and weigh every word that was said tonight. Nothing goes unheard and taken seriously. Being the numbers guy, of course, I'd remind everyone that the state death toll for COVID is 8,613. La Crosse County has gone up to 100, which is 6 more than the last month meeting. I personally had 4 of my friends that got COVID this last month, and 2 of them were in the ICU. And unfortunately, if everybody remembers a young man called, his name was Sam Cornforth. He graduated about 4 years ago. Nice kid, good athlete, very smart kid. His dad died of COVID on August 30th. And so that was a tragedy, and I wish all his family the best, and I personally wish I could have done something to help. One thing that I did notice that was interesting in doing my reading, I do a lot of reading and try to get as many numbers as I can. There was one article that I read that I thought was interesting, and that was everybody knows that Sweden, when COVID started, they did not mandate masks or mandate any kind of separation of people at any meetings or anything. They wanted to let herd immunity gather strength in that nation. Now, Norway was right next door, almost exactly the same size and the same population and almost identical size large cities. They did mandate masks, and they did mandate separations among their people. And so the first year before Sweden did change to masking and separation, Sweden had suffered 14,700 deaths in their nation, and Norway, with masks and social distancing, had suffered 826. So that's a pretty good statement about how effective mask and separation can be. Just let everyone know that I would say we, but I'm going to say I'm doing the best that I can to do the right thing for the kids and for this community based on the science that I know to be true. And if this community would all put themselves together and we could put all this virus behind us, we have to dig in together. We have to push hard, get it done. I did notice that it was said that 25% of our high school students are vaccinated. That seemed like an awful low number. If the kids want to get rid of masking and get back to normal and get rid of this virus, I would recommend that they get together, led by the seniors, and have the seniors pull together and try to get as many kids vaccinated in that high school as they can. They get up around 60, 70%, and I'm sure we wouldn't have masks anymore, and things would be a lot better at our school. That's all I have for tonight. Thanks.
All right, thanks, Gary and Anita.
I just wanted to thank all the speakers tonight, and like Gary said, especially the kids. Takes a lot of courage, even as an adult, to come up and speak, so I really appreciated what they had to say. Very heartfelt. That's all I have.
Thanks, Anita and Chris.
Sure. I too want to thank everybody that came out and spoke tonight. It's not easy to come up in front of everybody and be on YouTube. But thanks to the organizations that have donated to the great cause of the district. And I just want to, with us being back in school now for a couple weeks, I just wanted to take my time to thank all the teachers, staff, and students for everything they've done to get us back to a good start this year. Personally, I want to thank the bus drivers who are always friendly to my kids and wave to us as they pick them up and drop off our kids. I want to thank the specials teachers, the arts, music, LMC, PE, for all they do to make our children more well-rounded. My kids were in CRBA last year, and just to hear them back to singing and making art projects and getting books in the library, I just can't thank you guys enough for being there for our kids. We're just excited, my wife and I, to see the work that comes back and the skills that they develop and grow over the next year. As always, the teachers and EAs, they always go above and beyond and done so much work to make our schools back to being safe. To me personally, Mr. Eagle, thank you to all the other principals for their dedication to the district and adapting and leading from the front row. And a special thanks to the nursing staff, and especially Nurse Emily at Viking. They're working tirelessly to make sure our kids are safe and healthy. And then the nutrition services, the school lunch has always been a big thing in our house. Our kids love it. And the nutrition services team hasn't missed a beat. It's great. It's always been a big thing in our house to look over the menu for next week and see what days we're doing a hot lunch. And then finally, I guess hearing the news about John tonight, and the custodial staff just always behind the scenes making sure that the schools are clean. I asked my daughter, what do you think of the custodial staff? And she's like, this is a quote, "Our school would be a germ factory if we didn't have the custodial staff." So I just want to make sure that I thank them. And every year every new year is a big challenge, but this year is especially a big one. So just thank you from the bottom of my heart and my family's heart for everything that the district employees do to make sure we're back and safe. That's it.
Thanks, Chris. It's my turn. I just want to talk a little bit about the back-to-school event that Anita and I and Cheryl went to the day after our last school board meeting. It was very enjoyable. The video that they had put together, I don't think we could do a real one, so that was entertaining, and the auditorium's beautiful. It was good to see all the teachers back and all the employees back as well, so thanks for always inviting us to that. I do want to wish John good luck in his retirement. Very, very jealous, very jealous. I don't know, 46 years though, so that's awesome, and thanks to John. He is on the Building and Grounds Committee with me. He knows the buildings, he knows the area, he knows the history. He can say, do you remember when we used to do this? Do you remember we used to do that? So that's dedication, and we appreciate that highly. And thank you to all the students that came out today. It was, we tried to get the younger children in to speak first, just because we didn't want them to get tired or anything. So we appreciate everybody else that came out to speak too. And that's all I have. Brian, it's your turn.
All right, I've been hearing positive things from students in terms of how the school year has started. I can speak about my own children. Evan is doing a biking unit in PE, and as of today has decided he's independent enough to bike to school from home and back. So kudos to the PE teacher who's taking the biking unit, who's teaching that. And my daughter is doing a great job in middle school as a 6th grader. She's transitioned very well. The conversations we have around the dinner table regarding school, it just puts a huge smile on my face because the teachers are doing a fantastic job. I do have some shout outs I'd like to give tonight, especially to the bus drivers for taking the time before school started to go and learn the routes ahead of time, and every day ensuring that safe back and forth route to school and from home. I know we're short bus drivers, so this is also a call out if you have friends, family, anyone who is looking for just something to do during the day to apply to be a bus driver, because we could use them. To the nutrition services, especially for being adaptable during the supply chain shortages that we've been dealing with. I'm hearing from people that the menu changes quite daily, but they're doing a fantastic job. And so I appreciate the time that they're doing, what they're doing every day. Support staff as well, appreciate the work that you're doing with your own students, let alone knowing that, again, there's a sub shortage and that they're sometimes being pulled in multiple directions to help out and fill in classrooms. And so your work is recognized. And for the teaching staff and administration, I hope this academic year you take some time for yourself. One of the messages that we heard tonight too was about social and emotional well-being, and I think it's extremely important that as adults we take time for ourselves. And so as we approach this school year, don't check your emails in the evening once a week. Take off for the weekend. Spend some extra time with your family. It's important to take care of yourself as well. Thank you.
Thank you, Brian. And Emily?
I've had a lot to digest, so there's quite a bit here. So these last 3 weeks, I've heard a lot of kind things from community members, friends, students, and staff at HHS, and I've truly never felt more grateful in the last 17 years, really. And every person who reaches out to me, I tell them how grateful I am for them. Here are a few quotes of people who've reached out. Your motto of Zach has your back has been proven to be true so many times. You always show up to support the interests of students and parents. Sophomore girl. Please keep up the fight, you're doing great, and one day the student body will win. Sophomore girl. I would just like to let you know that you are making a difference. I know it may be hard at times, but we'll get through it together. Thank you for all you do. God bless you. Freshman girl. I appreciate you for sticking up for the student body. Senior boy. I just wanted to say that I appreciate you for standing up to people on the board who seem like they're biased against you and not willing to hear you out. Sophomore girl. Keep doing your job. That's what the student rep is for. Thank you for actually caring and being committed to voicing the opinions of the people you represent. A Holmen graduate boy. I respect you so much more than I knew. Thank you for doing your best to stand up to the board. Senior boy. These are just a few of the messages I've received from people on my social media and email. I would list comments from Facebook, YouTube videos, and in-person comments, but we would be here for quite a while. You may be wondering, Emily, why are you putting the genders of the quotes you read? Well, let me explain. There's a new group on Facebook named Holmen Parents that support the school board, and of course I requested to be in it since I do sit on this board, and oddly enough, I was only in it for a few minutes before I was removed, and I barely got to scroll through all the posts, but I did have time to find a post that said the following. As much as I respect Emily and don't want to attack her, she obviously represents the views of her dad and not necessarily the student body. And then in another post made by the same person, I think the board and community need to see that the current student representative is not truly representing the student body, the full student body, but instead her dad's views, end quote. So I included the gender of the earlier quotes because I'm a 17-year-old woman who knows what I stand for and what I represent. Surprisingly enough, I can do my own research and mature enough to make my own opinions. And I'm not usually the type to use the word sexist, but saying that I only represent my dad's views is sexist and demeaning, because if there was a man in my position, he would never be treated like this. There was a time when I was scared to voice my own opinion because I was scared of getting canceled or worried about what others thought about me because of comments like that. And it's also unfortunate that this post was written by another woman, even though it's human decency, especially woman to woman, to lift each other up rather than put them down. So that is why I included genders, to show that I'm not the only young woman with opinions that don't agree with yours. I would also like to remind people that I was elected into this position by students, a popular vote. If you want accurate and clear data about how students really feel, take a poll. No matter what side I support, people are going to disagree with me. I spoke my true colors knowing what I was getting myself into. It was not my dad talking into a little speaker in my ear. And at the end of the day, I would never put anyone down for standing up for their own beliefs. Hats off to all the people who spoke today. Even if I didn't agree with a lot of people who talked tonight, I wouldn't make a Facebook post tonight saying about how they only listen to their parents, because I believe that people can think for themselves. I would like to end my report with a thank you to all the community members, friends, and family for all the support this past month, and I wouldn't be in this position if I knew I was alone. And as of tonight, there is one positive case in the high school, or as of last night, there is one positive case in the high school and 6 district-wide. Thanks.
Thank you, Emily. And is there any other business that needs to come before the board at this time? Okay.
Do we have to vote on the consent items? Like,
I
yea or
can't,
nay?
I'm sorry, I can't hear you.
Do we
Ryan.
have to vote on the consent items?
We did.
We did? Because
Yeah.
I didn't think,
Yeah.
oh, we did, okay.
It was Anita and
And Jennifer seconded.
Jennifer,
Seconded, but then
yes.
did we have to
And
take
then you do a full vote,
A
though.
full vote?
Yeah.
We didn't do
Did you
that.
say aye and nay?
No,
Oh.
You were right, we did not.
no.
So maybe we should reflect and
Wanted to make sure we.
just-
Yep, good catch, Brian. So do you want me to redo it?
Well, just, what you need to do is you made a motion and you second, and then you just need to say all those that were in favor. say
All those that were in favor of consent agenda items, please signify by saying aye.
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 Sorry, and those opposed signify by saying nay. Thank you, Brian, for that. Sorry about that. And if there isn't any other business before the board meeting to bring to the board at this time, I would entertain a motion to adjourn this meeting.
So moved.
Anita has moved. Anybody to second?
Second.
Jennifer, sorry, has second to adjourn the meeting at 8:30 PM.
That attitude will get you a long way, sweetheart.
Is there any other discussion? No? Hearing favor, please indicate by saying aye.
Aye.
Those opposed signify by saying nay. Motion carries. Thank you, everybody.